Hello, everyone. I'm Kamaljeet here, a regulated Canadian immigration consultant, and I want to talk about medical inadmissibility. In my previous video, I shared a little bit about what medical inadmissibility is. So, and how do you, in this video, I want to talk a little bit more and also about how can you overcome it. So let's begin. Medical inadmissibility can affect anyone who is applying to visit or study or work in Canada or even live permanently. Normally you have to apply, you will be submitting your medical, either upfront medical, or when you're requested, you go to a panel physician from IRCC to, get your medical done. So there are three reasons for medical inadmissibility. One is danger to public health, danger to public safety, excessive demand on health and social services. So what is danger to public health? If your health condition will impact or endanger Canada's, the public health, it would mean that your application is very likely to be refused. And this decision is based on the results of the medical examination that you have taken through a panel physician at the time when you were to submit, or after submitting your immigration application. So your, medical exam results are, all the parts of the medical exam are considered. This will include the lab tests, which were done by the physicians. It could be the reports, if they have asked for extra medical tests to be done once a basic report was submitted. It could be, the finding is that you have some infectious diseases, like it could be an active tuberculosis. And it could also be a disease that could affect other people who are living in Canada, anything, whatever that would be. So when it comes to public safety, they can, your health condition could be something like related to your mental abilities to perform certain duties. And it could be, unpredictable or violent behavior due to mental health issues again. So that would endanger public at the time. Sometimes some things trigger off and people react. So that is one aspect. And all these, when Canada is looking at these health services that are required to protect people and to take care of the immigrant. In this case, the applicant, who is the person who is getting, who got the medical done and is medically inadmissible. They're also looking at the, social services, the expenditure that is involved, what is needed to treat your health condition that could negatively impact, waiting time for services that are available to other people in Canada too, and services that are needed to manage your health condition and can cost more than whatever the amount that has been, that is the average cost that is usually used as a basic threshold cost expense per person. If it increases, then that could also be a refusal. So there is an amount that is used by IRCC if the cost of the condition places an excessive demand in Canada's health and social services. And it is usually averaged out, for 5 years. And for it is right now, it is about, say, $25,689 Canadian dollars per year. So if it is beyond that, then this is beyond the threshold, so it could be refused. You could be refused. So medical inadmissibility rules may not apply, generally in case of refugees and their dependents, protected person, and also certain people who are being sponsored by their families, such as dependent children and common law partners. But yet it also depends, like it could be case-to-case basis. One will have to explore it a little bit further. And usually, if you are medically inadmissible, the immigration officer will send you a letter that is called as a procedural fairness letter. And you will receive this letter before the final decision is made on your file, on your application. And this is the time, as I explained in my previous video also, that this is an opportunity for you to explain whatever information you want to provide to support your application. And you can provide information and evidence related to your health condition and the medical diagnosis, and some steps from a physician or a specialist that supports your treatment to improve your health condition. And the kind of medication services that you need, it will include that. If your doctor is, changing your medication or has additional information to provide, that this is what is going to help you better. And also the one key thing here is that the expenses that are required, the cost of the medication and the treatment. So you should see what are the alternative methods that are helping your to lower the cost of your treatment. So this is usually this additional information with the PFL or the procedural fairness letter needs to be sent within 90 days of the time that is the date on the letter. From that time, you have 90 days to submit it. And if you are unable to submit it within that time, you must explain why are you not able to submit it, and you need an extension for this. And you must also submit, we highly encourage you to submit a plan, mitigation plan, like how can you, support your own health, and why is it that you should be allowed to enter Canada, and how can you, manage the excessive demand on Canada's health system. This has to be managed because it is going to cost Canada, and they are going to add that expense once you arrive. It's an added expenditure from above the average. So this mitigation plan must be very detailed and thorough. And definitely reach out if you need some professional assistance on the email below the video. I'll be very happy to help you professionally. Thank you.